today we are going to talk about the spinal cord in gross anatomy. So this is the spinal cord and it extends from the upper border of the first cervical vertebra to the lower border of L3. Now you can see that it has a coverings. So the spinal cord is about 46 centimeters in length in case of adults, and in case of children it is little less in length, and it extends up to the lower border of L3 in case of children. Now we are coming to this is the specimen. You can see the specimen. Now we are coming to the coverings of the spinal cord. So this is the dura mater. This which is picked up is the dura mater, and the arachnoid is coming along with the dura mater, and the thing which is glistening on the cord is the pia mater, and the pia mater has some modifications. So you can see that the pia mater is giving some modifications. So in the center the pia mater is thickened along the anterior median fissure of the cord. That portion of the pia mater is thickened, and that is called the linea splendens. That is the linea splendens. So this is the thickened part of the pia mater anteriorly along the anterior median fissure. Then laterally as we go, we can see a modification. You can see very clearly glistening tooth-like structures which are coming out and attaching the cord to the dura mater. You can see that. That's the attachments. So in this side also you can see these are called the ligamentum denticulatum. They are like tooth-like structures, and throughout the length of the cord they will attach the spinal cord to the dura mater. Now coming to the lower part, the lower end of the cord, you can see the lower end of the cord is getting swollen up to form the conus medullaris. This is the termination of the spinal cord, and along the at the end there is a modification of pia mater. Again it extends along, and that is called the filum terminale. It extends from the tip of the conus medullaris to the dorsal surface of the coccygeal vertebra. So it extends up to the coccygeal vertebra, dorsal surface of the coccygeal vertebra. Okay, so this is the dura mater. We can see over here. Yes, that is the dura mater. It is covering. You can see that, and that is the filum terminale. So the part of the filum terminale within the dura mater, that is up to the S2. The dura mater extends up to the S2. That is called the filum terminale internum. And beyond that it is called the filum terminale externum. So that is the dura mater. It extends up to S2. That is the filum terminale internum. And below that, below S2 till the dorsum of the coccygeal vertebrae, that is the extension of the filum terminale. Yes, so that is the filum terminale externum. So that is the internum, and now we can see the filum terminale externum. It extends below the S2. That is the second sacral vertebrae. That is, sacral vertebrae are actually fused to form the sacrum. Okay, so now we are coming back to the cord. So this is the spinal segment. So this shows the spinal segment. That is the thickening of the cord. Let's see the spinal nerves now. So each is a segment. So you can see the spinal nerves which are coming out from the spinal cord. There are 31 pairs of spinal nerves which comes out from the spinal cord. So now let's see. This is the ventral surface, and that is the ventral root, and they are coming out from the anterior lateral sulcus. That is the anterior lateral sulcus, and these are the ventral roots, and they join to form the ventral root of the spinal nerve. And you can see below the ventral root posteriorly, that is the dorsal rootlets to form the dorsal root, and the ventral root and the dorsal root will join together to form the spinal nerve. And you can even see the dorsal root ganglion. The swelling is the ganglion, dorsal root ganglion. Okay. So now we can see again the anterior median fissure of the spinal cord. This is the anterior median fissure of the spinal cord along which the anterior spinal artery runs. This is the anterior lateral sulcus. Both the sides there are two sulci. Anterior lateral sulcus, from where the ventral root of the spinal nerve will come out. Now coming posteriorly, that is the dorsum of the spinal cord, if you see. So this is all the dura mater. So you can see the posterior median sulcus. So that is the posterior median sulcus, and that is the posterior lateral sulcus, the two posterior lateral sulcus, which gives rise to the dorsal root of the spinal nerve. Those are the rootlets, and they will join and form the dorsal root, and the swelling is also seen. So that is the dorsal root ganglia. So that along that you have the anterior spinal artery, which is running down, and along the posterior lateral sulci we have the posterior spinal artery. And the anterior spinal artery actually supplies the upper part of the spinal cord, and it is reinforced by the radicular artery. Yes, there are the two posterior spinal arteries which will be running in the posterior sulcus. So these are all branches from the vertebral artery. Now this is a part of the spinal segment. So you can see that the spinal nerves are coming out from that. That is the segment which we shown. Yes, this is again we are showing the spinal segment. So this is one segment which gives rise to one pair of spinal nerves on either side. So we are having the 31 pairs of spinal nerves, and each spinal nerves are coming out from the corresponding vertebral foramen. The vertebral foramen, it's coming out from the corresponding. So you can see over here the lower end of the spinal cord, the conus medullaris. When we retract the nerves, we can see the conus medullaris, and this is a bunch of nerves which is called the cauda equina. This consists of nerves, spinal nerves from L2 to coccygeal 1. Okay, so this is the bunch of spinal nerves. Because this happens because the length of the spinal cord is less than the length of the vertebral column. So because the length of the spinal cord is length, so what happens is from L2 the nerves have to come out through the corresponding vertebra. So the spinal cord ends at the lower level of L1, but the nerves, spinal nerves will come out from the corresponding vertebra. So you can see over here the dura mater. This is the dura mater, which also covers the, keeps the cauda equina in place. The dura mater extends up to S2, and you have the phylum terminal which is in the center, which is a modification of pia mater. Yes, so we are going to see the phylum terminal. Yes, that is the lower part of the conus medullaris. That is the tip of the termination of the, and that is the phylum terminal, the glistening. So you can differentiate between the phylum terminal and the nerves. So this is the cauda equina, and a most important clinical applied aspect of this is, yes, that is the phylum terminal, is that the lumbar puncture. So that is the phylum terminal. So most important clinical anatomy is the lumbar puncture. So which is done after the termination of the spinal cord. Yes, it is done at that level. Okay, so you can see over here, this is the cervical vertebra, and this is how the spinal cord is going through the vertebral column. And then there is a space outside the dura mater, that is the extradural space, which is also having clinical significance. And this is the spinal, this is the cervical vertebra. This you can see the cervical vertebra, and the spinal cord is running through it.